Welcome to Unit 2, Part 1 of Molecular Pharmaceutics, focusing on nanotechnology and targeted drug delivery systems. Presented by Dr. Krishna Yadav.
This video covers Unit 2, Targeting Methods for Advanced Targeted Drug Delivery Systems. We will move from the conceptual framework to clinical evaluation. Our overview includes 4 key areas: the conceptual framework, nanocarrier architectures, preparation methods, and evaluation protocols. We will distinguish between passive and active targeting, review different carrier types, discuss solvent evaporation and microfluidics, and cover physicochemical and biological evaluation. Section 1 introduces advanced targeted drug delivery. This concept builds on Paul Ehrlich's magic bullet theory, aiming to control drug concentrations spatially and temporally at the disease site for modern precision medicine. Targeted delivery increases drug concentration at the site of action while minimizing systemic exposure. It alters pharmacokinetics and biodistribution, allowing carriers to navigate, evade immune surveillance, and extravasate. Targeting can be classified into first order, second order, and third order based on the level of specificity, from organs to intracellular compartments. Targeting is significant in modern therapeutics by enhancing the therapeutic index and improving bioavailability and stability. It overcomes multi-drug resistance, or MDR, and provides patient and economic value through reduced dosing and sustained release. Its evolution from doxil to antibody-drug conjugates highlights its transformative clinical impact. Targeted drug delivery systems selectively deliver therapeutic agents to specific sites, minimizing systemic toxicity. Strategies are broadly classified by mechanism, site of action, targeting level, and design complexity, as shown in the flowchart. Active targeting uses recognition molecules to bind selectively to receptors on target cells, ensuring high specificity and enhancing cellular uptake. Passive targeting relies on physiological characteristics, like the enhanced permeability and retention, or EPR effect, in tumors, reducing toxicity. This image illustrates the contrast. Passive targeting exploits leaky tumor vasculature to allow nanoparticle extravasation, relying on the EPR effect. Active targeting uses ligand-receptor interactions for high specificity, utilizing agents like antibodies or peptides to engage with receptors on the cell surface. Local targeting delivers therapeutics directly to a specific site, like intra-articular injections, minimizing systemic exposure. Systemic targeting uses engineered carriers in circulation to accumulate selectively at the desired site, often leveraging the EPR effect or pegylated liposomes for improved biodistribution. Targeting strategies can be location-based, focusing on a specific organ, or disease-based, focusing on pathological conditions. Location-based targeting includes liver and brain targeting, often using size or pH-responsive carriers. Disease-based targeting, such as tumor or inflammation targeting, uses carriers that recognize disease biomarkers. Biological targeting uses specific molecular recognition to guide carriers, mimicking natural interactions for site specificity. Key mechanisms include antibody-antigen and receptor-ligand binding. Physical targeting employs external forces or stimuli, such as magnetic fields or focused ultrasound, to direct drug accumulation or trigger on-demand release. This diagram illustrates the mechanistic pathways of drug targeting. Biological targeting involves molecular recognition and cellular internalization via receptor-mediated endocytosis. Physical targeting utilizes external stimuli, such as magnetic fields or focused ultrasound, for directed accumulation and stimuli-triggered drug release. Chemical targeting designs carriers to release cargo only in response to local triggers like pH or enzyme levels, seen in pH-sensitive release and enzyme-triggered prodrugs. Inverse targeting decreases drug concentration at non-target sites, such as the reticuloendothelial system, to prevent toxicity, utilizing methods like pegylation and stealth nanoparticles. This image contrasts chemical and inverse targeting. Chemical targeting shows a drug-loaded carrier releasing its payload in the acidic tumor microenvironment, or via enzyme-triggered prodrugs. Inverse targeting illustrates how pegylated or stealth nanoparticles evade macrophages and the RES, allowing for prolonged systemic circulation and passive accumulation in diseased tissue. Let's explore advanced drug targeting approaches. Dual targeting achieves simultaneous specificity at both macro and micro scales, combining passive accumulation with active receptor binding. Double targeting employs 2 independent mechanisms in concert, like magnetic guidance paired with active ligand targeting.
Combination targeting integrates diverse strategies such as passive accumulation, active ligands, and external stimuli-responsive release to maximize therapeutic impact. This synergistic approach aims to overcome single-strategy limitations and significantly improve therapeutic outcomes. This diagram visually represents the three advanced targeting methods. Dual targeting shows both passive accumulation and active ligand binding. Double targeting illustrates magnetic guidance and ligand binding. Combination targeting includes multiple strategies for enhanced effect. Drug targeting is classified by the biological level at which delivery occurs, from broad anatomical sites to precise molecular pathways. This defines the order of targeting, which progresses from first order to fourth order. First-order targeting directs drug delivery to a specific organ or tissue, like liver targeting. Second-order targeting focuses on specific cell types within that tissue, such as targeting tumor cells. Third-order targeting aims for intracellular compartments like the mitochondria or nucleus. Nanoscale drug delivery systems offer incredible advantages, such as improving the solubility of poorly dissolving drugs and crossing tough anatomical walls like the blood-brain barrier. However, they also come with significant limitations. Scaling up manufacturing is highly complex, and their tiny size means they can trigger unwanted immune responses or accumulate in organs like the liver. To fully understand nanoparticulate drug delivery, we classify these microscopic carriers into four main structural categories. First, we have polymeric nanoparticles, like micelles and dendrimers. Next are lipid-based carriers, which include well-known structures like liposomes. Then we have inorganic options, like gold and silica. And finally, specialized architectures built for highly specific delivery needs. Diving into the first major category, polymeric nanoparticles are highly versatile systems made from biocompatible materials. They generally come in two structural forms. First are nanospheres, which are solid matrix systems where the drug is evenly mixed throughout, often leading to an initial burst release. Second are nanocapsules, which act like tiny reservoirs with a liquid core surrounded by a protective shell, allowing for a steady, highly controlled zero-order release of the medication. Zooming in on nanospheres, these structures act like a solid matrix, where the drug is uniformly trapped within a polymeric network. Because they lack a separate liquid core, they are much easier to manufacture. They release medication following Higuchi kinetics, meaning there is a quick initial burst of the drug, followed by a slower, sustained release over days or weeks. This makes them highly effective for vaccines and chemotherapy, though achieving a perfectly constant release rate can be challenging. In contrast to nanospheres, nanocapsules feature a liquid core surrounded by a protective polymeric shell. This outer membrane acts as a precise rate-controlling barrier, allowing for a highly desirable, steady, zero-order release of the drug. They are fantastic for carrying high payloads of oily drugs and protecting sensitive medications from harsh stomach acid. However, this shell is fragile. If the membrane ruptures prematurely, it can release all the medication at once, a dangerous event known as dose dumping. Furthermore, scaling up their production is notoriously difficult. Moving to lipid-based nanoparticles, these carriers use natural fats, offering much better biocompatibility and lower toxicity than synthetic plastics. The first generation, solid lipid nanoparticles, or SLNs, trap drugs inside a highly ordered solid crystal lattice. While great for skin delivery, this strict structure often squeezes the drug out over time. To solve this, scientists developed a second generation, nanostructured lipid carriers, NLCs. By blending solid and liquid lipids, they create an intentionally, imperfect lattice filled with tiny voids, allowing for much higher drug loading and a much longer shelf life. Here is a clear visual of why second-generation lipid carriers are so effective. The strict ordered grid of a first-generation SLN tends to squeeze medication out as its crystals shift over time. By intentionally creating an imperfect structure with liquid lipids, the second-generation NLC creates safe voids that lock the drug in place, drastically improving both loading capacity and shelf life. This table provides a head-to-head comparison of first-generation SLNs and second-generation NLCs. While both are easily scalable using high-pressure homogenization, NLCs clearly take the lead in performance. By blending solid and liquid lipids, NLCs solve the major physical stability issues of SLNs, specifically preventing drug expulsion and polymorphic transitions over time. This upgraded structure ultimately gives NLCs a much longer shelf life and makes them suitable for a broader range of applications, including oral and injectable delivery. Moving to the third structural category, inorganic and metallic nanoparticles are unique because they offer simultaneous therapeutic and diagnostic capabilities, a concept known as theranostics. Gold and silver nanoparticles use optical properties for light-based therapies and antimicrobial action. Mesoporous silica acts like a microscopic honeycomb, using smart gatekeepers to release drugs only when triggered by specific bodily stimuli, like pH changes. Finally, SPIONs use superparamagnetic iron cores, allowing doctors to physically guide the medication to a tumor using magnetic fields while simultaneously enhancing MRI scans. Inorganic and metallic nanoparticles are prized for their theranostic abilities, meaning they can diagnose and treat diseases at the exact same time. From light-absorbing gold and smart-releasing silica honeycombs to magnetically guided iron oxide particles, these inorganic structures offer unique optical and magnetic properties that traditional polymers and lipids simply cannot match. Finally, we reach our last structural category, specialized nanocarrier architectures. First are polymeric micelles, which brilliantly self-assemble. They use a water-repelling core to safely tuck away the drug, surrounded by a stealth outer layer that hides it from the immune system. Second are dendrimers. These are highly symmetrical, tree-like macromolecules. Because they are so hyper-branched, they have an incredibly high surface area, allowing scientists to attach numerous targeting molecules for highly precise, lock-and-key drug delivery. Carbon nanotubes act as ultra-thin nanoneedles that can pierce directly through cell walls to deliver medication, loading drugs via complex pi-pi stacking. While highly effective at bypassing normal cellular barriers, their needle-like shape carries serious, asbestos-like safety risks, making surface modification absolutely mandatory. Thank you for watching. Please like, share, and subscribe.